Hello everyone, this is Rishabh, and today's topic is pharynx. In pharynx, we will study its structure, the muscles, the fascia, their modification. We will also discuss some atlas images, and later, we will go into nerves and the blood vessels. Don't worry about the nerves, innervation, and the blood supply. Those are separate topics, and we will deal with it separately. So, just now, focus on the structure of pharynx and the pharynx itself. So, what is pharynx? Pharynx is a fibromuscular tube which extends from where? From the base of skull to C6 vertebrae or at the level of cricoid cartilage. Cricoid cartilage, you know, from the larynx. One thing which is very interesting, guys, the level at which the pharynx ends, C6, here esophagus begins. Similarly, the level at which the pharynx ends, which is the C6 or the cricoid cartilage, here trachea begins. So always remember at C6, your larynx ends, trachea begins, your pharynx ends, and your esophagus begins. Now, you all know pharynx has three parts. What are the parts of pharynx? First is your nasopharynx, then is your oropharynx, and then is your laryngopharynx. So as the name says, nasopharynx, it will be present posterior to your nasal cavity. So you see this, the cranial fossa here. So your nasopharynx extends between the floor, or you can say of the cranial fossa, till the level of your palate. So nasopharynx here, cranial fossa till the palate. This level is known as nasopharynx. Now your oropharynx extends between the palate and your hyoid bone. You see this bone? This is your hyoid. So your oropharynx present posterior to your oral cavity. Here, this part that you see here, this is your oropharynx. This is nasopharynx. Nasopharynx between the the cranial fossa and your palate level. That is your nasopharynx. Oropharynx between the palate and the hyoid bone. This is your oropharynx. Now, you see this hyoid bone, and you see this is your thyroid cartilage, and this is your cricoid cartilage, the cartilages of the larynx. So, this part that you see here, this one, this is your laryngopharynx. Laryngopharynx. So let's write it down. Nasopharynx is between the cranial fossae or the bones to palate. We are talking about level. वो कहाँ से कहाँ तक extend करता है? Oropharynx between the palate and what? Hyoid bone. Then is your laryngopharynx. Laryngopharynx किधर होता है? Between the hyoid bone to what? Yes, cricoid cartilage. So see, this was your pharynx, entire part, and we divided into nasopharynx, oropharynx, and the laryngopharynx. This part, nasopharynx, this part, oropharynx, and this part, laryngopharynx. Pretty easy, right? Now, in anatomy exam, you have a scheme, the fascia of the neck. So in that you have to study various fascia, and to build the basics, let's study a bit about the fascia of the neck, all those membranes. So let's study pharyngeal wall. Pharyngeal wall, it means, suppose this is your neck. If I cut it from here or I cut it from here, your neck will be like this. Anteriorly you will have larynx, posteriorly you will have your pharynx, then you will have vertebrae, prevertebral fascia and everything. So we are going to see your pharynx in detail, like what are the structures, what are the layers there. So in the pharyngeal wall you have 4 layers. Okay, let's draw it all. First layer from the inside is your mucous membrane. Mucous membrane, in the histology you have studied, you have mucosal epithelium. And what kind of mucosal epithelium we will have here? That would be stratified, non-keratinized, squamous epithelium plus lamina propria. What is lamina propria? That is areolar connective tissue. Now we will have our second layer. What is the second layer here? Second layer is your pharyngobasilar membrane or the pharyngobasilar fascia. Don't worry, I will make you remember everything. Pharyngobasilar membrane. Why do we call it pharyngobasilar membrane? Because pharyngo means it is present inside the pharynx, and basilar means this is coming from the base of the skull. You see, this is your base of the skull, and this membrane will come from here to the entire down part. So that is known as pharyngobasilar membrane, because it is coming from above the base of the skull down till the level of even this membrane ends. Where does it ends? We will discuss when we will discuss the fascia of the neck, so don't worry. Now we are just discussing the structures. So this was our second layer. Now the third layer is quite important, because the third layer is our what? These are the muscular coat. Muscular coat, it means we will have our muscles in the third layer. Muscular coat. And in the muscular coat, you have your two kinds of muscle, your longitudinal muscle, and you will have your circular muscle. We will discuss about everything. And on the outermost part, you have a fascia known as buccopharyngeal fascia. This is your buccopharyngeal, BUCCO, pharyngeal fascia. हम fascia किसे कहते हैं? Fascia are the structures which encapsulates or cover our muscles. So let's see here. You see, this is a muscle of pharynx, and here you will have your muscle जिसका नाम क्या होता है? Buccinator muscle, right? For buccination. Now this fascia, what it does is, since this is outside the muscle, which is the fourth muscle is third layer, and this layer is fourth layer, the buccopharyngeal fascia. This fascia will cover pharyngeal muscle as well as buccinator muscle. That is why this fascia is known as what? Pharyngo, since it is covering the superior constrictor of the pharynx, and pharyngo. Sorry, I am really sorry. This is buccopharyngeal fascia. Why? Because this is covering buccinator muscle as well as covering the pharyngeal muscle, which is the superior constrictor. I'm sorry guys for the background. The kid is crying. I think he did not sleep well. I'm sorry for that. So we covered 4 layers. The inside was mucous membrane. Second was our Pharyngobasilar. Why pharyngobasilar? Because this is covering the pharynx from the inside, coming from the base of the skull. So pharyngobasilar, pharynx and the base. Now, third is our muscular coat. Muscular coat has two kinds of muscle, longitudinal muscle and circular muscle. And fourth is our buccopharyngeal fascia. Why buccopharyngeal? Because this is covering buccinator muscle as well as the muscle of pharynx. Now, one more thing, guys. You see the second layer we have here, pharyngobasilar fascia or the pharyngobasilar membrane. Here, on the posterior wall, you will see there is a thickening. This thickening is known as, this thickening is not just present one part. If I draw it like, if this is your pharyngobasilar fascia, this thickening is not present just in one part. This is longitudinal. Okay, this is you can say here you will have your cranial part, and here you will have your you can say thorax. So always remember, this thickening is longitudinal and not just a point, and this thickening is known as median raphe. Median raphe is a longitudinal thickening of your pharyngobasilar fascia, and it will serve as the point of insertion for all the constrictors. Let me show you. You see this? This is your superior constrictor. This is your middle constrictor, and this is your inferior constrictor. They all originates anteriorly, but where are they inserting? You will see this is a line. So this line on the posterior wall is the thickening of your pharyngobasilar fascia, and it serves as the insertion of all of your constrictor muscles. So that's our 4 layers and their significance. Now we discussed everything about the fascia and everything. Now let's discuss about our muscles or the muscular coat, which is the third layer. So pharyngeal muscle. Now in the pharynx we have two kinds of muscle. We have our longitudinal muscle and we have our circular muscle. You know, in the entire alimentary canal you have seen this fashion that you have outer longitudinal, inner circular muscles, for example in the intestine. But here the circular muscle will be on outside while the longitudinal muscle will be on inside. Got it? Always remember it. No one is gonna ask you, but even if they ask you, you are going to answer it like a champ, which you are. Okay? So you have longitudinal muscle and you have circular muscle. So only two kinds of muscle. Now, whether it's longitudinal muscle or the circular muscle, both are three. You have 3 longitudinal muscle and 3 circular muscles. Name it. First longitudinal muscle is your, what is it? Yes, stylopharyngeus muscle. Second is your, don't worry, I will make you remember their origin and insertion because you don't have to remember it. सुनोगे याद हो जाएगा. You will just listen and you will remember it. Stylopharyngeus muscle. You will have your palatopharyngeus or the pharyngeus muscle. And the third is, yes, salpingopharyngeus muscle. Now see, you see the first word here, stylo. It means its origin is what? Styloid process. What is styloid process? Do you know? Let me show you. Let's open the gallery. This is our skull. You see this? This one? This is your styloid process. So this muscle will come from here down. And what it will do, whether it will insert on the wall, on the thyroid cartilage, don't worry. We have got you covered. Just a minute. So origin of the styloid process is stylopharyngeus muscle, styloid process. Same feature here. Palatopharyngeus origin where? Origin will be in the palate. Let me show you. You see this? Here you have your palate. From the palate, a muscle is coming, the green color muscle that you see here. Okay? So origin is palate. Insertion, I will tell you. Now, third one is salpingopharynges. What is the origin of salpingopharynges? Salpingo means eustachian tube. So, you see here, you have eustachian tube here. What is eustachian tube? A tube which, balances the air pressure between your middle ear and your oral cavity. And you might have felt the need of it when you go to the airplane. Your ears gets very heavy and you start feeling slight uncomfortable. That is because of the difference in the air pressure. So this eustachian tube helps in equalizing it. When someone gives you chewing gum or something, when you chew, it maintains the it equalizes the air pressure between your oral cavity and the middle ear cavity. So always remember. So origin of your salpingopharynges is your, yes, that is your eustachian tube. Now we covered origin of all the muscle. What is the insertion of them? So always remember their insertion. Don't worry, I'm removing. You will have everything in the notes. Insertion, 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 not ISS, it's INS for insertion. So what would be the insertion? Always remember they all inserts on the pharyngeal wall. You see this muscle, it originated, these are your constrictor muscles. Where is it going? On inside, because longitudinal muscles are present inside. And where are they going? They are inserting onto the wall of pharynx. See this also, this is also inserting on the wall of pharynx. So always remember, you have three kinds of longitudinal muscles: stylopharynges, origin, styloid process, insertion, wall of the pharynx; palatopharyngeal, second muscle, origin, palate, insertion, pharyngeal wall; third is salpingopharynges, origin, eustachian tube, insertion, wall of the pharynx. Another thing, let me just take the photograph of our larynx and I will tell you something about it. Very interesting. Okay, this is not gonna let me copy. Yeah. These muscles go and they insert onto the posterior wall of your larynx, thyroid cartilage. So always remember, they will insert onto the pharyngeal wall as well as posterior border of your larynx. Of what cartilage? Of the thyroid cartilage of the larynx. And what are that cartilage? Don't bother, I will tell you about it in some other class. So right now, three longitudinal muscle: stylopharynges, palatopharynges, salpingopharynges. I think I did not show you the where is stylopharynges. You see this muscle, you see this bone, styloid process. So from the styloid process, a muscle will come and it will go inside the pharynx, because this is longitudinal muscles are present inside, so this will go inside. So styloid process coming from there, so stylo going to the wall of pharynx, pharynges, so stylopharyngeus muscle. So three longitudinal muscles covered. Now let's discuss about our three circular muscles. Let's remove them and yeah, we are good to go. First circular muscle is our, what is the other name of circular muscles? Constrictors. Because when they contract, their diameter reduces and they constricts. See, diameter reduces, they are contracting, diameter reduces, and they're constricting. That's why they are known as constrictors. So you have three constrictors: superior constrictor, middle constrictor, and inferior constrictor. The constrictor which is present most above, superior constrictor; constrictor which is present most lowest, inferior constrictor; and the constrictor present between them, inferior constrictor. I will draw a scheme and I will tell you, so don't worry. Let's draw it. So this is your base of skull. Okay, don't worry guys, we will draw everything and we will make you understand everything till you don't understand it. This is what? This is your base of skull. And you know you had median raphe. Why? Point of insertion of all of the processes or all of your constrictors. So yes, this is your median raphe. What was it? It was the thickening on the posterior wall of what fascia? Pharyngobasilar fascia. So this is your base of skull. Base of skull. And what is it? This is your median raphe. दिक्कत तो नहीं होगी याद करने में? I know नहीं होगी. You are champion. So now superior constrictor originates from three parts. You know you have lateral pterygoid bone, medial pterygoid bone. So in the lateral pterygoid, medial pterygoid, you have something in one of them known as pterygoid hamulus. Hamulus means hook. So from this hook, and this is your mandible bone. This is your mandible bone, mandible or the lower jaw bone. This is your pterygoid bone, and similarly is not pterygoid. Sorry, this is your mandible, and in the mandible you also know you have something. What is it? In the mandible you have mylohyoid line. Got it? Mylohyoid line for the mylohyoid muscle. Let me show you. What is it? This is your mylohyoid line here. You see this? Here the mylohyoid muscle attaches. So this line. So let's draw it now. One more thing. Pterygomandibular raphe. From the hamulus of the pterygoid process to the mandible, there is a raphe thickening of another membrane. This is known as pterygomandibular raphe. So your superior constrictor originates from pterygoid hamulus, pterygomandibular raphe, and posterior part of the mylohyoid line. Let's color it. This is your superior constrictor. Three origins. What are the three origins? Let's write it. Origin include pterygoid, hamulus. Second is pterygomandibular raphe. And third is what? Yes, posterior part of what? Mylohyoid line. Three origin. Got it? Let's make it little beautiful. So this is your superior constrictor. Three origin. What is the insertion? All three constrictor have same insertion. That is your median raphe. Now middle constrictor. This is even more easier. You know you had styloid process somewhere here for the stylopharyngeus muscle. Styloid process from the skull, you know. And you have something known as hyoid bone. Hyoid bone has greater horn or the greater cornua, lesser horn or the lesser cornua. This is it. And you know, from the styloid process, one ligament comes here that is known as stylohyoid ligament. Got it? I will show you the atlas image, so don't worry. This is just a scheme to make you understand. So the middle constrictor originates from, just a second, it originates from the greater cornua, the lesser cornua, and the membrane itself. Sorry, ligament. So you have three origin also, the greater cornua, lesser cornua, and the stylohyoid ligament. So you have three origin in the middle constrictor also. Got it? So this is your middle constrictor. Now you have your inferior constrictor. Like let's write the origin here. Middle constrictor. You have greater cornua of the hyoid, lesser cornua of the hyoid. Don't worry, everything is in the notes and that's well presented. And the inferior constrictor. Inferior constrictor has how many origin? They have two origin. So first, let's put our larynx here. You see, this is our larynx. Now, inferior constrictor is divided into the two part. One part will originate from the thyroid cartilage and another will originate from what? Cricoid cartilage. The part which is originating from the thyroid cartilage is known as what? Thyro, because originating from the thyroid cartilage. Pharyngeus, because that's a muscle of pharynx. So thyropharyngeus. So you see this oblique line, they will originate from the oblique line. Upper muscle fibers would be oblique while the lower muscle fiber would be transverse. So this is your inferior constrictor part, which is your thyropharyngeus. So this is one muscle, inferior constrictor, and inferior constrictor has two part, thyropharyngeus and the cricopharyngeus. See, it might take me time to teach you, but trust me, if you learn it this way, it might take you 30 minutes to learn something from me, but next time, no more than 5 minutes to revise. And from the YouTube and other sources where you study from, you will study everything for the 15 minutes. And next time when you go to revise, again 15 minutes. And then maybe there would be some cross question which you might not answer. But if you study from me, my lectures, which is free here, you will answer each and every single thing. I don't think there would be some question which anyone can ask till your undergrad level which you might not answer. So focus here. Everything is here. So this is your thyropharyngeus muscle because coming from the thyroid cartilage, originating from the thyroid cartilage. Similarly, you have your cricoid cartilage from the posterior border here. The muscles will come, originate, and common insertion of all the constrictors. That is your median raphe. See, they are going posteriorly, inserting onto the median raphe. This is known as cricopharyngeus. This is your cricopharyngeus muscle. And thyropharyngeus, cricopharyngeus are collectively known as what? They are known as, yes, inferior constrictor. So we discussed about three longitudinal muscles and three circular muscles. We drew the scheme of three circular muscles also here. So that is our longitudinal and the circular muscles, the fascia, the membrane, and the everything. Now from here we can do two things. We can either discuss something like the innervation, or we can discuss the structures which goes between them. But first discuss the structures. So another scheme here. This is the base of skull. This is the median raphe. Before that, let me show you the constrictor muscles here. You see this? This is your pterygoid hamulus. This is your pterygoid hamulus. This is pterygomandibular raphe, and this is the posterior part of mylohyoid line. From three parts originating, going posteriorly, inserting onto what? Median raphe. Similarly, middle constrictor originating from the greater horn, lesser horn, and the stylohyoid ligament. Originates here, goes posteriorly, inserting onto what? Inserting onto the median raphe. Third one, the inferior constrictor has two part, Cricopharynges, thyropharynges. So thyropharynges from the oblique line of the thyroid cartilage originates and goes posteriorly, inserting onto the wall of your inserting onto the median raphe here, the thyropharynges. Similarly, you have cricopharynges from the from the posterior border. It originates of the cricoid cartilage and it goes where? Onto the median raphe. So these are your three constrictor muscles: superior constrictor, middle constrictor, and inferior constrictor. Now you see something, they are overlapping each other. They are overlapping each other. So two things are peculiar about constrictor. First thing is your they overlap each other, and second thing, between these superior constrictor and middle constrictor, some structures will go inside. Between middle and inferior constrictor, some structures will go inside. And I had told you when pharynx ends, esophagus begins. So between inferior constrictor and your esophagus, some structures go inside. And also, I told you this is your cricopharyngeus. Cricopharyngeus is also known as upper esophageal sphincter. And esophagus has various constrictions at different level. So this is your first constriction in esophagus, that is your cricopharyngeal sphincter. Now, let's see the structures which goes inside. And one more thing, guys, I had discussed pharyngobasilar fascia, right? Coming from the base of the skull. Now, from inside, this will enclose a cavity here. There is no muscle here. So, if I tell you that this is your neck, in this part, they will enclose a cavity. And this cavity is known as what? Cavity of Morgagni. The cavity of Morgagni, similar to the foramen of Morgagni of your pharynx. Let me show you the cavity of Morgagni. Do we have that here? Yes. You see this? Here you can see the pharyngobasilar fascia, and inside that you will have cavity of Morgagni. So let's draw the scheme. What structures goes outside or inside? So first of all, this is your superior constrictor. Got it? This is your middle constrictor, and this is your inferior constrictor. Got it? Superior, middle, and the inferior constrictor. Let's do it this way. Superior constrictor. Then you have your middle constrictor. Just give me a second, guys. Superior constrictor. Technology makes everything very easy. This is your middle constrictor, overlapping. This is your inferior constrictor, again overlapping. And here you had a cavity, the cavity of Morgagni. So between the base of skull and the superior constrictor, you have a few structures. Remember I told you Eustachian tube here? You see? Eustachian tube present in the upper part here. So yes, one content is the Eustachian tube here. One content would be Eustachian tube. You will have two arteries also here, ascending palatine artery and what? Palatine branch of ascending pharyngeal artery. Ascending pharyngeal artery, that's a branch of your external carotid artery. When I will discuss the supply of the face, the external carotid, internal carotid, I will discuss them separately. Right now, just remember the name. And if you can't remember, when I teach you the blood supply, come to the lecture and just remember it, revise it. So you have three structure in this part. Between the base of skull and superior constrictor, you have three things. What are they? Eustachian tube. Second is your ascending palatine artery, and third is palatine branch of ascending pharyngeal artery. Got it? Now, between the superior constrictor and middle constrictor, you will have a few structures which will go inside. First is your, I showed you here what muscle was going inside between superior and middle constrictor. This muscle was your stylopharyngeus. See, it is going inside. So yes, stylopharyngeus will go inside here. Stylopharyngeus is going inside. And stylopharyngeus is supplied by a nerve. In the cranial nerves, I will tell you. That nerve is what nerve here? That nerve is cranial nerve 9. I'm using green color so to make the picture more contrasty. We denote the nerves always as what? Yellow color. So don't get upset. Or let's correct it. That is your cranial nerve 9. Why is it going inside? Because it has to supply your stylopharyngeus muscle, and stylopharyngeus is also going inside. So they are in a relationship. One goes inside, another also goes inside. That is between superior constrictor and middle constrictor. Now, one thing, at this level you have palate. So the artery that you see here, ascending palatine artery or the palatine branch of ascending pharyngeal artery. At this level you have what? At this level you have your larynx. In the larynx you have thyroid cartilage, and below the larynx you have what? Thyroid. So you will see the thyroid multiple names, multiple instances. So between middle constrictor and inferior constrictor, the structures which will pass is, let me show you. First take this image, and then, no, it's not here. Just give me a second, guys. Where is it? Let's just take it from here. Yes, let's take this one. Just a second. So at this level you have, your larynx. So between the middle constrictor and the inferior constrictor, you see you have the larynx here. This is your hyoid bone, and this is your thyroid cartilage. And between hyoid bone and the thyroid cartilage, what is here? Thyrohyoid membrane. In the thyrohyoid membrane, you see you have one aperture, one opening here. So from this opening between middle constrictor and the inferior constrictor, few structures will go inside. What is few structure? So in larynx, I will tell you, you have vocal cord here. The vocal cord is here. Above the vocal cord, the innervation and the blood supply is different. Below the vocal cord, the blood supply and innervation is different. So see it here. One nerve, internal laryngeal nerve. Why internal? Because this is going inside. So internal laryngeal nerve will be here. Besides internal laryngeal nerve, what will be there? Superior thyroid artery, because this is above the thyroid. So superior thyroid artery. So let's write what is between. Here we will write it here. Between middle constrictor and inferior constrictor, what do we have here? We have internal laryngeal nerve. What else? We have superior thyroid artery. between them. Now, I told you when the pharynx ends, esophagus begins. So, what is between esophagus and your inferior constrictor? So, here one nerve goes inside, one artery also goes inside. The name of the nerve which is going inside is recurrent laryngeal nerve. Why recurrent? Because this is a vagus nerve. It will go inside your thorax and it will come above. So recurrent laryngeal nerve. And the another artery is inferior thyroid artery, because this is coming from below the thyroid. So superior thyroid artery here, this one is superior thyroid artery and this one is inferior thyroid artery. So this was the constrictors, the spaces between them, the structures passing between them. We saw it all. Now anything else? Yeah, let's see about the blood supply and the innervation. See, most of the time the blood supply is of the pharynx is ascending pharyngeal artery. Ascending pharyngeal artery is a branch of external carotid artery. The external carotid artery, for example, if this is your heart, the left subclavian, the right brachiocephalic, the left subclavian, then all those gives rise to all those internal common carotid. The common carotid gives rise to what? Common carotid gives rise to internal carotid. Why internal? Because goes inside the skull. External carotid, why? Because it does not go inside the skull. External carotid gives rise to lot of those branches, and one of those branches ascending pharyngeal artery. Why ascending pharyngeal? Because if this is your pharynx and here is your external carotid artery, this will go above and it will supply it, and this is ascending, going above. That's why ascending pharyngeal artery. Now what about the innervation? I will discuss the innervation separately in the cranial nerves, but right now just remember this. You have a muscle, stylopharyngeus muscle, and this muscle is supplied by cranial nerve 9, and that is why they were in relationship and they were going together. Here you see stylopharyngeus, cranial nerve 9. Now another one is your cricopharyngeus. Cricopharyngeus nerve, sorry, not nerve, cricopharyngeus muscle. Cricopharyngeus muscle was supplied by what? Internal laryngeal nerve. Got it? Internal? No, not internal. Recurrent laryngeal nerve. Got it? So two muscles supplied by cranial nerve 9 and recurrent laryngeal nerve, while the rest all is supplied by what? Vago accessory complex, about which I will tell you in the cranial nerves. So we discussed it all. The constrictors, those muscles, what is mylohyoid line, those the longitudinal muscles and everything. We discussed nasopharynx, oropharynx, laryngopharynx, the median raphe, and median raphe here, it was coming from the base of the skull. You see here you have one tubercle. This is known as pharyngeal tubercle. And if I show you on the base of skull, you see this is a point highlighted. This is your pharyngeal tubercle. From this part, your median raphe originates. So we discussed it all, and with that we are done. So this is the pharynx. We completed the pharynx. Just try to remember whatever is in the notes. I will show you the notes, and that's more than enough. In the notes, a lot of it was from the clinical part, so I have removed the clinical part so that it's get easier for you. For example, these things you don't have to study. So what I did was I removed them from the notes. So for you, you just have to study about the pharynx. Why? Because this is capsule course where I will be coming and will teaching you, and this session is free. And try to remember what I have said. And if you don't remember something, like what, see, the way you have to study is, the strategy should be, first you will see my lecture. When you see the lecture, you have to read the notes. Once the lecture is completed and you have read the notes and you remember everything, you are good to go. Do every topic this way, and once you are done, then watch the card discussion videos. And then after watching the card discussion video, watch my question and answers PDF. See, This course is designed so that help you in many ways. First, this course is one-stop solution for everything. If you need concepts, I will give you. If you need to revise, I will give you card discussion. I will discuss all the cards. I will discuss all the schemes. If you need to, draw the scheme, I will draw the scheme and I will show you. If you need the notes, I will give you the notes. If you need the answers PDF, I will give you the answers PDF. Why? So that you don't have to study the SAPIN. Those answers are from the SAPIN, so you won't have to study it. One mistake I have seen a lot of you doing, and that is straightly jumping onto the PDFs. Don't do it. That's very, very bad and very wrong. Because if you do it, you won't have the concepts. And if you go to any teacher who likes to test student, you that would be very difficult for you. So study this way that if you go even to the HOD or anyone, they should feel like you have studied very beautifully, amazingly. Go there, know everything, slay the questions, teacher will be happy, you will get happier marks. And it's not just for the marks, guys. If if you study the anatomy, which is a foundational subject, it is going to help you in your life. It is going to help you in the surgery. It will going to help you in your ENT. It will help you in a lot of your medicine, all of your clinical subjects. This is a foundational subjects, that's why. But if you don't study the anatomy now, when you go to study those subjects, those teacher won't teach you the anatomy. They will have like applied anatomy like topics, but not like this, because they are teaching uh, their सब्जेक्ट. अगर उन्हें पढ़ाना होता तो वो anatomy जैसा सब्जेक्ट ही नहीं होता. हम कोई भी टॉपिक्स उठाते वही उसकी anatomy डिस्कस करते. So read the anatomy now because you have time now. If you have to because in the future you will not have time. You will have all the resources, you will have money, you will have friends, you will have your internet, you will have everything, but not the time. Even if you want to, you won't have the time to study it, or you will have to completely rip you off. So you have still time and study it. Don't take re-exam in a bad way. It's giving you an opportunity and the pressure to study it. आज नहीं पढ़ोगे, एग्जाम पास हो भी जाओगे ना, तो तुम्हें नहीं आएगा. एंड the meaning of exam is to test you, not giving you marks. So you will be get tested when you know everything. So know it all. If you need any help, just text me. Any question and answer, anything. I'm always there to help you all. And I like to help students. All this started because I started teaching students, helping them. I took classes in the department. They came to me, they said, Bhaiya, we wasted our lot of time, so our basics is very bad. So I started helping them, and then it went all. Everyone has anxiety. I also had the anxiety. I had talked with the HOD and everything. Everyone that I won't give the exam. But I overcome it. I gave the exam. I passed with 5. I passed with 5 in Pakajuski. I also had amazing rating 5 plus in all the big controls. And still I had the anxiety that I might fail in the anatomy exam. So everyone has anxiety. If I had stopped back then, I might not be teaching you, because who would have come? So don't doubt yourself. And if you have to, if you are feeling the doubts, the self doubt, study and take a test, because test is going to tell you everything. And in exam you will be asked 4 questions, one scheme and some cross questioning. You might get lucky and teacher asks you what you know, and they might not ask you what you don't know. So you might pass the exam, but deep down you will know that you don't know the anatomy. So don't do it. That would be a bit of disgrace. A bit of disgrace, not in any matter, but it would be bad for you, because if you pass the exam, maybe you won't study it later. Because if you could not study one subject in 2 years, you have to study 18 more subjects in your 4 years. Everyone in our university, whether it's Rubalko sir, Vagapova ma'am, Viliana ma'am, Albira ma'am, Olga ma'am, who was my favorite teacher, they ask you questions not to tease you or anything. They are amazing teacher, and a teacher should be like that to test you all. And I have seen like I was one of their favorite students. They have mentioned my name to different students. Why? Because I studied and I did it. They, we didn't had something for which they were. I was their favorite. I was only favorite because I was studying. My other friends were only favorite because they were studying, and if you are not, because you might not be studying. So they are no one's enemy. They, if you, I will tell you this thing strictly. If you are studying in a Russian medical university, if you show a bit of ambition and aspiration, you will get more than what you could have got in India about the opportunities. Because see, there is a difference between Indian and Russian mentality. They, they thrive on ambitions and everything. In India, everything is boring. That's why we don't have a lot of inventions and everything. But see the Russia. Why? Because they are amazing people. Some student, I am not saying all of them, some student might not know as much as theory as India, but they will be are very interested, very eager, very ambitious about everything, because they have something inside them which differentiates Indian students and the Russian students. And what is it? They have interest in the subject. They are not studying to know the subject. They are studying so that they can use it. So please study. If you study and teacher will say you, they will help you in the ways you have not even imagined. Even Dean, I went to Rasool sir, he have helped me immense number of times and in everything. I just have to text him. I just have to WhatsApp him. I just have to talk to him. He does everything what I need. Of course, for the good things. I won't even go for the bad things. I'm not an idiot. So, if you study and if you are good, if you go to them, they will help you the ways you have not imagined. They will really help you. So please study. Studying is not just the solution for your exam. It will help you in your future. It will help you become a better doctor. It will help you understand other subjects better. And it will also give you some reputation and respect. So please study, and if you come up with any doubts, anything, let me know. I will give you the lectures, I will upload it, I will also give you the notes. We are trying everything so that you can study. Me, Pranav Bhaiya, the entire team of Anatomy Champs is trying everything so that we can help you. Because when you text us, Bhaiya, you were a part of my preparation, you teach amazingly. When I meet you, when you guys come to me, that's the real reward. No amount of anything can give the pleasure when we hear that we were help to someone, we were able to make some difference. Because like the way I have taught you, I don't think you will get it on YouTube or anywhere like that. You won't get it. You can just go surf the internet and everything, you won't get it. So we are trying everything to help you. So please help yourself. If you need anything, let me know. I take doubts every time. I have helped students at 3 a.m., 4 a.m. at the night, and even in the 6. Whenever I am awake, whenever I see my phone, I do it. And one thing is, I don't like, try to stop the message. If I'm not replying to you, it means I don't want to. Because a lot of students have come to me with the bad things. Where do you know this teacher? Please don't text me for it. If you have a doubt, text me. I will answer it within a minute if I'm free. So please study, guys. If you study, if you want money in the life, you will get a lot of money. If you want respect in the life, you will get a lot of respect being a doctor. And if you want to fight, of course, you will be beaten if you are in India. I'm not making, a joke or something, but this is a real life thing right now. So please study, focus on your health. If you feel anxiety or anything, please reach out to someone. You can also text me. I will help you as much as I could. I'm not a certified person for it, but as a friend, as a peer, as a senior, actually, I can help you. So if you have anything, any doubt, any need, text us. Me, Pranav Bhaiya, we will help you. Yeah, text me for any doubts of the anatomy. And if you have, this doubt like where are notes, where are everything, we have one admin. So text them. They are there. We are also students. We have to, take care of every day course also. So if you have anything like that, please text them, they will help you. For any doubts, text me. So please study, guys. I will wrap up the session with this. I hope you study well. I hope you give your exam and I hope you pass it all. Till now, last year, I gave the capsule course to your seniors, 115 students, 115 of them passed. I also taught histology to around 100 students, all of them passed. I was also helping students in the prof classes. I was taking live lectures till previous semester, and I think I could not get to all of them, but I think they passed. So please study. If you need anything, we are here. Don't go for notes, because if you can read notes, or if you can read question and answer and you think you can understand it, read Grey's Anatomy. अगर पीडीएफ पढ़ के सब कुछ समझ आ जाएगा, read Grey's Anatomy. You will get concepts, you will get good marks. I hope you understand, and if you need anything, let us know. Have a good day. Goodbye.